getting into ortho is easy, right? Well, I know it sounds crazy. Getting into ortho is easy, but that's the easy part because you still have to get through and survive. Tell us, Doc, what was the hardest part for you about becoming an orthodontist and an ortho specialist, in your opinion?
I would say that the hardest part for me was understanding that there's so much that you don't know when you initially start, and just giving yourself the grace and patience to work through that and know that by the time you're done with the program, that you're going to be totally fine. But it's so overwhelming at first with all of this new language and analysis that you're learning, and you don't feel like you know what you're doing at all.
Becoming an orthodontist is a dream for many people, but that dream requires 2 or 3 years of advanced dental education, and that could be a challenge. Stay tuned as we talk to a doc who just completed and survived her ortho residency, and she's going to tell you all about it and how she did it. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, for another episode of Ask Dr. Darwin on the New Dentist Podcast Show. We talk about getting into dental school, getting into residency, surviving residency, which is today's episode, and then life as a new dentist. Guys, be sure that you are continuing to share, comment, like, and subscribe as well. This episode is being brought to you by GetIntoDentalResidency.com. Right here, GetIntoDentalResidency.com, the ultimate resource to help you get prepared for your application, get you prepared for your interviews, get you prepared to rank your programs. For more details, go down below and check it out. Hope to see you in the training soon. Special guest who's back. She's back, y'all, and she survived. She survived ortho. It's been what, 30 months? 2.5 years, almost 3 years?
Yeah.
Dr. Sybil Jones is here, and she's gonna spill the tea about how she survived ortho residency. Before that, Doc, please reintroduce yourself for those that are meeting you for the first time.
Hi everyone, my name is Sybil Jones. I am a brand new ortho grad, so excited. I graduated Spelman 2014, and I did my dental school at Meharry, graduated 2021, I'm sorry. And I went to Case Western Reserve for my orthodontic training.
You went and you completed.
I completed. And
you completed your program, right? And that's the topic. That's the information we want to hear about. I'm so happy for you. Congratulations. Yeah, you've been on the grind these last 30 months, right?
Grinding. And it's honestly really full circle having this conversation with you again, because I feel like I talked to you a bunch, trying to get into residency. And then when I finally matched, and here we are, the culmination.
Here we are. By the goodness of the ortho gods and the universe, the ortho universe, right? But why ortho? Let's just dive right on into it. And guys, be sure that you're staying all the way through. We got some great tips and some advice that are coming up that you don't want to miss. So why ortho? Why did you decide to do ortho?
So for me, I chose ortho for a plethora of reasons. I definitely had a blessing with my dad being an orthodontist, so I had a really good influence from him, but I really did try to fight it for a really long time. Initially, I wanted to do derm, and I was lost and misguided. And I met my mentor, Dr. Holloway, who is involved with increasing diversity in dentistry pipeline program. And my first time I met her, she's a family friend. And I was like, yeah, I want to be a dermatologist. And she was like, no, Sybil, you're going to be a dentist. And I was like, yeah, okay. But I went to an NDA conference, I believe my first year at Spelman. It was in Baltimore, and I'm from the Northern Virginia area. And my best friend at the time or she's still my best friend, but both her parents are dentists. And so she was there and I was going because I wanted to hang out with her, and my dad was going to go catch up with some friends. And when I was there, I just had a moment like, why am I fighting this? Like, why would I not want to be a dentist? Like, my dad, my grandfather was one, my uncle was an oral surgeon. I have like a lot of really good like mentors and people on my side that can help me really get to this dream. So I feel like that was my like dental and ortho awakening. And once I really got into ortho and my interest peaked for it, for me, it's like ortho is the intersection of biology, psychology, and biomechanics. So for me, it's really amazing seeing the self-esteem of your patients, especially the kiddos, develop and increase during your time with them. And biomechanics, the process of moving teeth, is pretty fascinating to me. It's like we're the architects of aligning the teeth and occlusion. So it's pretty cool.
Yeah, it's really cool. And I think that's one of the reasons why a lot of people uh are really interested and want to become orthodontists too, right? And the lifestyle as well. Um, Not just the clinical and the technical skills that are needed, but the lifestyle is nice. I've heard stories from people saying that they liked ortho because they don't have to give any more anesthesia too.
I mean,
You know?
I think I had to give so there's these expanders called MARPIs that we do for like adult patients when their palates fuse, and we have to give local and give injections for it, since you're literally screwing a like an anchorage device into their palate. And I had to give local, and I was like, I had to act like I was cool, like it's fine. I'm like, oh, I have not done this since I was at Meharry Medical College, but the patient doesn't know that, I can, and everything was fine. Everything was
Yeah,
fine.
yeah, yeah, yeah,
Definitely not something we do on the
yeah.
daily.
So uh we saw some of your social media posts back in December, November, graduation, and I saw that post and I was like, "Oh, shucks, she's done. Like she's done." So let's back up and reverse and talk about the program that you just completed. Now, we want you to tell us a little bit more about the program, Case Western, and what a typical week is like, if and what kind of research is required as part of your curriculum, and we'll start there so people have a better idea as to the rigors and what the training program is like as well.
All right. So again, I graduated from Case Western Reserve, located in Cleveland, Ohio. A typical week for us, it differed kind of each year that you're in the program. So first year, we typically have an 8 a.m. lecture. It will be a seminar with one of the part-time faculty that is over the clinic for that day. Typically, we have patients 9 to 5, but also first year, you're doing a lot of your master's courses. So not every day you're going to be in the clinic, but the courses we take, which one of them was a complete surprise to me when I got there, we had to take anatomy again, like cadaver dissection. I was like, I thought I left this at West Basic Center at Meharry, but here we are again. But we took anatomy, biostatistics, epidemiology, path, and like an intro to research kind of course. So that's first year, you get your courses out the way. Second year, you still have the 8 a.m. lecture. So again, seminars with the faculty that's there. You have more so than 9 to 5 days with patients, but Tuesday afternoons, we would go visit our faculty. It was a private practice rotation. So it was about 5 or 6 faculty. We would spend 5 weeks every Tuesday going to their office, and just it was free. We could ask them any questions like business, how they set up their like the flow of their clinic. Everyone practices at my program. We were really, really good with being exposed to all the different types of ortho systems. So a lot of people, were heavy Invisalign practice, or they used a certain type of brackets or certain type of wire system and stuff. So we had free range to ask them questions, ask the assistants, interaction with everyone. So that was really, really great. And that lasted probably like July until about November, December. And then when you come back, it's again 9 to 5 with patients. Sometimes as a third year, you would have 8 a.m. seminars, but the big change for us was Tuesday afternoons, we would have off, which was a super blessing. And we would have that time allocated to either studying for boards, because we take that in May of our second year, or I'm sorry, our second into our third year. And then we also took to prepare for our master's research that we had to do. And that was it. And then third year, it's kind of smooth sailing, just patience, and you're in and out as long as you got your thesis defense done. I thought patience and went back home.
Yeah, yeah. And you said a key word, your thesis. Your
Yeah.
thesis. So what was your research in your program?
So I did my master's thesis defense on comparing the shear bond strength of 3D printed brackets to traditional brackets. So I printed 3D printed brackets from our printers at school. And then there's also a company called Lightforce, and they 3D print ceramic brackets. And I also compared it to traditional ceramic brackets and metal brackets. So I went to a lab right outside Chicago with a whole bunch of like extracted, discarded teeth, and I used an Instron shear bond tester machine and kind of recorded the different strengths that it took to debond the teeth, to debond the brackets, and see how see how much it took for them to either stay on or break, just because with dentistry in general, technology is super taking off, but in ortho, it's always brand new things going on. So now people are really getting into 3D printing brackets. And so if you can do it, at your own lab, we were really interested to see how clinically sufficient that they would be.
Yeah, that's great. That's great. With that research, what were some of your quick conclusion or synopsis?
Well, out of the ones that I tested, the light force brackets, which are the 3D printed ceramic ones, they had a super, super high shear bond strength, which is good because you do want the brackets to stay on the teeth, but you don't want it to be so high that when it's time to debond, you're like taking off enamel or something crazy. Like, you definitely don't want to damage the teeth. So it was just like a very interesting range of strengths that I was getting. And so that definitely raised some concern with the light force kind of being like the outlier, because I think it was like 40 in the like clinical sufficient range is like 18 to 20.
Yeah. So I just wanted to mention that and ask that because yes, candidates, docs, guess what? You will be doing research. And it does help to have maybe a couple of ideas of some possible research topics that you like to explore as a resident, because you may get that question in your interviews coming up. So just wanted to share congratulations on that research that you had to do in your program. Tell us a little bit more about the program as things that you really, really liked most about your program.
Well, I honestly feel super blessed to have been at Case Western. The just everything, I would say 10, 10, 10 across the board. The facilities are impeccable. They recently renovated their clinic. So when I started in 2021, I think they had only had like 2 other classes there. So everything is very like top of the line, all the newest technology, which is super great to be able to use. The full-time and part-time staff were really, really full-time and part-time clinical faculty were super amazing. I feel like everyone was very patient. It was really great being in an environment where you felt like everyone was very supportive and didn't make you feel bad for asking questions if you didn't understand everything. The program is 15 residents, so 5 each class. And I think they do such a good job at selecting the residents that are going to be in the program. We all really got along, and I know that if there was any point where I needed something from someone, they had my back, or if they saw me running around the clinic like a crazy lady, they would be more than happy to help me or see if I needed something. And then also our program director, Dr. Palomo, he was really, really good about getting us exposed to everything with ortho and kind of really allowing us to be a free-thinking orthodontist. Like our program didn't just shape us to be like, you have to use this type of system or you have to think like this. If someone wanted to come and give us a lunch and learn on something that might have sounded crazy, he was like, look, they can come. I want you guys to have your own opinions and thoughts and be exposed, because after you leave here, you're still going to be exposed to it, you know? So we really appreciated that. And he also was really good at getting us to go to a lot of conferences. I felt like I was at a conference like every other month during residency, which sometimes was a lot, but it's really good networking and it's really good being able to, you know, consistently see people. Because once you're in this field, I mean, this is, I mean, my career that I'm going to be in for, you know, a long time. So people that I'm seeing now, the residents I'm constantly seeing, the reps, everyone. So it was a lot of really, really good experiences.
That's great.
Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you, but you got to hurry up because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode.
And those experiences are key to have, and to at least know about, right? As you're going through this process of applying the programs, any and all information that you can get about the program is going to be very, very beneficial, right? It's going to be helpful, not only in selecting your program, but also, I mean, selecting your program as far as putting it on the list of programs that you want to apply to, but also at the end of the process, which is putting together your rank list. It's important to know things that the residents really, really like about the program itself. However, there's also some things that you probably didn't like or you found to be the most challenging. And that could be both at the program or just within the specialty, you know, training within the specialty as well. Share with us a little bit more about some of those challenges that you had within your program or just overall with becoming and surviving, getting through this residency training program.
So I'm gonna be super honest. I feel like the thing that I disliked the most was that I had to be located in Cleveland, Ohio for 30 months of my life. And I might sound like a super hater, and sorry to everyone from Cleveland, but it was just so cold and gray and depressing. It made it really hard for me. Hey, Daddy. It made it really, yeah, that was tough for me. That was my personal experience. But some other areas I would say that was challenging, you know, Dr. Palomo blessed us with a lot of things, but in return, of course, we had to work super, super hard for all of it, which is perfectly fine. But time management was definitely a challenge because it's hard being in clinic from 9 to 5 and then also having to do all of the other things like case presentations and records and classes and studying and making aligners and 3D printing and writing all your notes. So sometimes it just would feel like there's not enough hours in the day. I was at school probably from 8 a.m. to 8 p.m. a lot. And so it's tough when you go to school and it's dark outside and you come home and it's dark outside, but that's just a part of the grind.
Yeah, almost like dental school again, right? 8 to 8.
Yeah.
Actually, that's early. That's early. Dental school, I remember being there like late, 10, 11, 12, and having to be kicked out of the building at times as well. So anything you would have done differently, knowing what you just experienced over these last 30 months, anything about your training that maybe you wish you had done or had the opportunity to do?
I will say, and I don't know if this might be specific to my program, but we're very, very clinical, which is great, but we are not super didactic. And that's in regards to the actual like study of ortho. And yeah, we have lectures, you know, people coming to speak to us a lot, but we didn't have like a biomechanics course or like any courses just on ortho, and so much of the things were taught in clinic. So for me personally, when I had to sit down and study for our board exam, a lot of the didactic kind of foundational things didn't click for me until I was like sitting down and studying for that. And I wish during my first year, I would have taken more time to, you know, try and really study the foundation of things, which looking back definitely would have been hard because we were, you know, getting accustomed to a new program, being in a new place, learning everything. But I think for me and knowing myself as a learner that I kind of wish I would have pushed myself a little bit harder.
Now you mentioned the boards. As part of your program, is there a board review built into the curriculum? How does that work at Case?
So we have, so for our board exam, we have a certain amount of research articles that we are required to read and look at because those are questions on the exam. And we would have a literature review course a few times a month, especially right when we around board season. And then the big literature book that we read is Fundamentals of Orthodontics. I believe it's by, or I believe that's the name, but I know it's by Dr. Profit, and that's kind of where we get a lot of our information.
Of course, the grandfather and the
So
godfather of ortho, right?
we would have a Profit course where we would kind of go through each chapter, and that would kind of, I think for my year, that started probably January and went through like March. And I think the current residents now, I believe they started in like November, the Profit course, which was good, but the exam, the questions just have really like, you know, really tough questions. And a lot of the stuff for me didn't click until I was actually sitting and studying for it. So, but to answer your question, we don't have a like super like ABO exam, like a review. And for the test, again, ortho is not black and white. It's super abstract. You can get the same result doing it 100 different ways. If you put 10 orthodontists in the room with one case, everyone's going to say something different 9 times out of 10. And so because of that, and because we're able to be taught by so many different part-time faculty and understanding all the different ways that they do it, not everyone is teaching us, okay, this is how the board wants you to answer and think about these questions. Not saying anyone's right or wrong, but it's just, you know, when you're taking a test, like I want to know how they want me to answer the question, because I can give you the same result, but I just want to answer it correctly for the American Board of Orthodontics.
Yeah, yeah. And I'm not familiar with that board exam, some of the other ones, but is that one of those exams that's not multiple choice and kind of there's some prompts and you have to explain and write and to give you the latitude of potentially approaching it a different ways to get a similar result?
So the first part of the exam is written, and that's what you take during residency. So that
Right.
is multiple choice. And you do there's like the sciences kind of portion of the exam, and then also there's some cases that you have to
Right.
answer the questions to. But there's the second part, which is clinical, which I'll be taking in September, is the part that you take after you graduate. And that is clinical. So I believe they give you a case and you just like write out as much as you can about the case and answer
And
the
I th
different.
and I think that's been a change over the most recent years. That everyone has a set number of cases that they have to review versus cases that they had to do
Yeah.
actually clinically and then present.
Mhm.
I remember talking to some candidates and some completers of programs about how that changed as well. So that's good. That's good. Well, we're talking about candidates. And for those of you that are listening and watching, if you haven't taken any notes, this is the section that you want to take notes on. Because Dr. Sybil is getting ready to tell us what makes a good or even an outstanding orthodontic residency candidate.
So I would say someone who is didactically competitive, which I know is like, you know, the first basic thing you hear about ortho, but application interview season is so competitive that it's really important to at least have that to get you in the door.
So what is that though? When you say academically, I'm sorry, didactically or academically competitive, what are some of the components of that? Because I can think of a couple, but they may not be the same that you have.
I mean, I would say it's super high GPA, trying to be as high in the top of the class as you can. And also in saying that, I mean, I did good in dental school. Was I number one in my class? Absolutely not. But I still did good. So I think they're also really looking for candidates who are well-rounded, ambitious, show that they're teachable. Having some experience with research does help, since most programs you do have to do a master's thesis defense. But I also want to say that in ortho is, because it's so competitive, I know a lot of times people are very quick to discourage dental students when they say that they want to do ortho. And I just want to say, don't let someone tell you no before you even start.
Yeah. What's for you is for you. Just because it's not for somebody else doesn't mean it's not for you.
Yeah, because I know there's so many people who, have reached out to me and are like, oh, like, but my GPA isn't this, and I don't have these grades. And I'm like, still try. You still have time. There's lots of other things that you can do. Network, visit programs that you're interested in. But don't let someone else squash your dreams before you even try.
Yeah, that's key. That's key. If you want to be an orthodontist, you have to believe that you are going to be an orthodontist, right? Get yourself out of your own way and get to being an orthodontist by being an orthodontist, right? Doing those things. Yeah, so GPA is not necessary everything, but yes, in ortho, just like oral surgery and pedo and endo, and maybe a couple others, yes, they're gonna look at your GPA. They wanna know what kind of student you are and what type of learner you are as well. But as you said, it's not everything. You got your rank, your ambition, being teachable, your research experience, all the things that you can also put together in your application to demonstrate some of that as well. Because we all know, yes, the programs may ask you what your GPA is, but that will probably be the last time you'll ask that questions, because the patients are not going to ask and be like, oh no, Dr. Sybil, I don't know if you can work with me. What was your GPA in dental school?
They would.
So I make light of that, but it's reality. Just like getting into dental school too. It's one of many things that are looked at as part of that holistic admissions process. Great segue. Great segue to tips and advice for those folks that are listening right now, you guys that are listening and watching right now, for how to go through this process, how to best go through this process and applying to ortho programs. Because guess what? It's about to be match application pass season all over again. It's coming in May, right? And ortho is early, meaning phase 1. So as soon as pass opens up in May, you need to be sprinting to getting this application together. So what are some tips, advice that knowing what you know now and going through this process probably about 48 months ago? No, yeah, 48 months. No, yeah, 48 months ago, that you want to share with people that are listening and getting ready to put their applications together?
I would say apply early for sure. Try and get your app in as soon as possible. One thing that really helped me through the application process, I had an Excel sheet where I kind of listed out each program, like all the information about it, what they wanted. Some programs want, most want the application fee for sure, but some want pictures, some want just different types of information. So it was super helpful staying organized for that. Again, setting your best foot forward and having a, competitive GPA, competitive GRE, because at least that can get you in the door. And, having good personality, and again, showing that you're teachable, and, you know, things that can make you stick out from other candidates is super helpful, because at the end of the day, everyone is going to like walk in the door and be like, okay, this person's competitive, but what makes you stand out? That's important. And then again, just being positive and believing in yourself, and knowing that it's okay that if you don't match on the first round, that doesn't mean that it's not for you. It just means that delayed, not denied, which is fine, and that you can still do it.
Yeah, I think that last piece is very key. Be positive and believe that it's a process. I say this all the time. It's a process. And just because part of the process means you have to do more doesn't mean that it's still not going to be for you. You know, a no just means no right now. Doesn't mean no forever. Some great tips. Great tips. Hey, if you guys have found some value in what we've been talking about, put yes, Dr. Sybil in the chat, and also in the comments down below. Again, this is an opportunity, a rare opportunity to talk to and hear from someone who just survived ortho residency after another almost 4 years of of training, right? After 4 for dental school and 4 for undergrad. So this is 12 years in the making, right? Doc, what's the best way for folks to get in contact with you if they have some more questions? I know people have been reaching out to you over the last 3 years since we connected as you were applying to ortho programs. But what's the best way for people to follow up with you now that you're in the ortho office, in the ortho community officially? And what's the best way for people to connect with you?
I would say either by email, and my email is sybilrj@gmail.com, or via Instagram. My Instagram is sybil.jones with 3 S's.
There you go. Right up top there. Right up top. Right up top. Check that out. Contact Dr. Sybil. Sybil, what's Doc, what are you doing now? Tell us a little bit about your current post residency completion efforts, and maybe some future plans that you are getting ready to put in motion.
So I graduated beginning of December, moved back home to the DMV, just started back working like 2 weeks ago. Had to take some time to recuperate. So I'm working part-time with my dad at Jones Orthodontics, and then I'm also working part-time with another orthodontist. His name is Dr. Amar, at Elite Orthodontics.
Future plans? Thinking about maybe opening up your own or expanding the family practice?
Probably try and expand the family practice. You know, of course, I just finished learning a whole bunch of orthodontics, but what they don't teach you is all the business stuff. So now I'm trying to wrap my head around all of that, which is a challenge, but I'm not scared.
Yeah. It should be a crime. It is a crime. It's negligence on our dental schools and our residency programs, some of the residency programs, not being able to include the business of dentistry. And that means being a dental entrepreneur, right? Because that is very key to your survival and you being able to deliver your expertise or our expertise to the people that need it, right? Very, very key, which is also another reason for all of the ortho professionals to also be involved in organized dentistry, right? Because there's many organizations that we as professionals can connect to for professional development. And in that realm of professional development is also things about the business of dentistry that we can learn. So yeah, it kind of sucks that you that we have to learn it external to all the training that we do, but we are in a profession that has a mission of lifelong learning, right?
Lifelong learning, continuing.
Lifelong learning. especially when technology is involved, as you have already seen in your program.
Yeah, I will say Case did do a good job with, our private practice rotations. Again, like our faculty were kind of like totally open books for us to ask them like whatever about, how they started their practice, like finances, all types of stuff. So that was really, really helpful. But it's different when you're on the outside and it's like, okay, now I have to do it. And I know I have a lot of resources and people who can still help me and who are more than willing to, but it definitely is like kind of having the lens, like the ortho is the easy part, but the business is, now this is the difficult part.
Yeah. So continue to reach out and explore and connect with professionals, not only in your area, but all across the country. And, dentistry is international. Everybody got teeth, at least, or had teeth if they did have them taken out. So there's also resources internationally, right? Folks, orthodontists are coming from all parts of the world, coming to the US, not only to train, but also to practice. So vice versa as well. But this has been a very well organized and well, what's the term I'm looking? Well organized discussion. This has been a great discussion about your success and you surviving. So very proud and happy for you. And now you can go live life a little bit, right?
Yes, I'm ready to live my best life after residency.
That's right. Well, thanks so much for joining us and sharing your journey and your survival through ortho. And also congratulations. Guys, go to the next video. That's your next journey. Go to the next video right now. Go.